Here's a demonstration of a musculoskeletal hand exam.
Good morning, I'm Dr. Smith. I've been asked to examine your hands. Is that okay with you?
Yes.
Okay. Have you got any pain anywhere?
No.
No, okay. If I cause you pain during the examination, feel free to let me know. I've also already washed my hands. And as I'm examining you, I'm going to be presenting to the examiner. Okay? Alright, so firstly, I'm walking into the room. I am examining the patient's face, and she does not appear to have a Cushingoid appearance. And now I'm going to start by looking at the hands. So usually I would examine her with her hands on a pillow, but we haven't got that today. So we're just going to have her hands resting on her knees. Starting first with a general inspection. So looking on the dorsal aspects of her hands, I'm looking for any redness, any swelling, like sausage fingers. I'm looking for any scarring, looking for deformity. So I'm looking for changes related to osteoarthritis. So I'm looking for Bouchard's nodes in the proximal interphalangeal joint and Heberdin's nodes in the distal interphalangeal joint, and these are absent. Also looking for changes related to rheumatoid arthritis. So that would be a swan neck deformity, Boutonier's deformity, as well as a Z thumb. There's also no ulnar deviation involving the metacarpal phalangeal joints. Moving on to looking at the fingernails, looking for pitting or any ridging, any vasculatic changes, and there are none of these. Now I'm going to ask you to turn your hands to the side like this. Great. And what I'm doing now is looking for volar subluxation that can be present in rheumatoid arthritis, and that's absent. If you can turn your palms towards the ceiling. Okay. Now I'm looking at the palms, looking for skin changes again, palmar erythema, looking for any scarring that may indicate, say, a Dupuytren's contracture release or carpal tunnel release. Also looking for any muscle wasting, and that's absent. Now I'm just going to get you to do a few movements for me. So I'm moving on to active range of motion. Can you please pull your wrist backwards like this? So wrist extension and wrist downwards. Okay, and your wrist inwards and outwards for me. Okay, can you make a fist and open up your fingers? And can you close your fingers together and open them up? All right, excellent. Okay, I'm going to look at some thumb movements as well. So with your hands, can you bring your thumb towards the ceiling? So that's retropulsion. Now if you turn your palm towards the ceiling, okay, can you now point your thumb towards the ceiling? So that's abduction. And now put your thumbs next to your hands. That's adduction. Pull your thumbs outwards for me. Okay, so that's extension. And all that range of motion looks normal to me. Can you also meet your thumbs with your little fingers? Okay, so that's opposition, and that looks intact. Now I'm going to move on to functional grips. Can you do that for me? Like make a pincer grip? Okay. Now do a pinch like this, like a key, like you're holding a key. Okay, so this is important for using keys as well as putting cards into ATMs. We've already done opposition. Now, can you make this shape for me, which is a 3-jaw chuck? Yep. Can you make this shape for me, which is spherical, or a 5-jaw chuck? Can you make this shape for me, which is a cylindrical shape? So important for holding glass. Okay, excellent. Now, I see that you have a name tag. Are you able to remove that from your pocket and then put it back on? So that's a functional task. If there was a pen, I would ask her to write. If there was a button, I'd ask her to undo the button and redo it. So now I'm going to move on to some of the special tests. So if you're able to put your hands back to back like this and bring your elbows down, right, that's great. And if you can hold it there for 30 seconds, what I'd be doing here is to assess for any numbness. If the patient experiences this after 30 seconds, that's a positive valence test. All right. Now I'm going to quickly tap on your wrist like this. All right. So this is a Tinel's test, looking for carpal tunnel as well. Have you got any tingling in your hands when I do that?
No.
Okay, so that's negative. And then moving on to Finkelstein's test. So that's putting your thumb into the palm, wrapping your fingers over it, and then now if you can turn your fist across like that, if you can pull your wrist downwards like that. Have you got any pain across the wrist over here? Okay, so that's negative for the Quavans tenosynovitis. Now I'm going to start having a feel of your hands. Again, remember, if I cause you any pain, please let me know. So starting off by feeling for crepitus. Okay, can you please close your hands, your fingers over my fingers? Okay, and do that and open it up and do that a few times for me. So feeling for palmar crepitus, and that's negative. Okay, you can relax. Now what I'm going to do is to move your wrists and your fingers. Okay, so starting with the right wrist, I'm just doing passive extension and flexion of the wrist, doing ulnar and radial deviation. Now, having a look at the MCP joints, so the metacarpophalangeal joints. So just ranging all of the joints actually. So I'm just going to go with all the fingers. And then, Mr. Examiner, if you'd like me to stop at any time, please let me know. But so far, it is looking okay, and you repeat this for both hands. The other thing I would do at the NCP joints is look for volar subluxation. And that looks like it's fine. Some quick power tests. So again, can you turn your palms towards the ceiling and point your thumb towards the ceiling, and don't let me push your thumb down. So that's looking for carpal tunnel syndrome, and that looks strong. Now can you spread your fingers apart as well, and don't let me push them together. So that's testing the ulnar nerve. And if you can pull your wrist up like that, don't let me push them down. So that's looking for the radial nerve, and that looks intact. Now checking for the dermatomes of the peripheral nerves. So does that feel normal to you?
Yes.
So that's the radial nerve distribution. And for the median and ulnar nerve, so I like using the fourth finger. Does that feel normal to you?
Yes.
So that's the median nerve distribution. Does that feel normal to you?
Yes.
That's the ulnar nerve distribution, and I will repeat that on both sides.
So I've completed this hand examination. There was no evidence of rheumatoid arthritis or osteoarthritis. There was normal active and passive range of motion and normal neurological function. In summary, this is a normal hand examination. On a side note, you may also like to add palpating for rheumatoid nodules along the forearms, and also an Allen's test to briefly assess the vascular supply to the hand.